Hey guys, Dr. Martinez here over at Design Chiropractic. And today I want to talk about a condition that I see fairly often here in the clinic. Might be something you might be dealing with, and if it is, we're going to talk about how chiropractic can help and some of the benefits of chiropractic on this condition. So the condition I want to go over is called carpal tunnel syndrome. You've probably heard of it. If you spend a lot of hours, in front of a computer screen, typing a lot, what will happen is over time, you'll start to irritate the nerves and the tendons that travel within your wrist out to your fingertips, and you start getting carpal tunnel syndrome or symptoms of carpal tunnel. And what that is basically, they call it carpal tunnel because, well, first of all, we all have one. What it is the bones in your wrist and the tendons and ligaments that surround the bones in your wrist create a tunnel underneath your wrist, which is where all those tendons from your forearm go out to your fingertips. So you have to imagine you got all these muscles here in your forearm and they control your fingertips. Well, all that has to pass through this tunnel within your wrist here. And so whenever you start getting compression on the nerves and the tendons around this area, you get inflammation build up, starts to actually irritate those nerves, it starts to create the symptoms of carpal tunnel syndrome. So whenever you hear carpal tunnel, it's not necessarily that it's specific to people who have the syndrome or the symptoms. We all have a carpal tunnel. It's just whenever it starts to irritate it starts to create those symptoms of numbness in the fingertips. That's when it's carpal tunnel syndrome. So a few things you can do to kind of help counteract that and how chiropractic can help with that. So kind of look at it, like we mentioned, it's a tunnel. We kind of look at the bones in the wrist almost like a bridge. And they create a bridge. And so you got 8 sets of bones in your wrist, and whenever they're in line, or where they're supposed to be, they should kind of create an arch like that. And you have a bone right in the middle of them. They call it the lunate. And just like in a bridge, when there's that piece of stone that holds the bridge together, when that bridge collapses, it flattens out your wrist. And so what usually causes that is, if you're typing all day long, you're on the phone or you're on the computer or whatever, those bones will start to collapse and they'll start flattening out right underneath where those nerves go into the hand. And so if there's irritation like that for hours on end, you're talking 8 hours a day at a job where you're compressing those nerves and you're putting pressure on those nerves, over time that inflammation starts to build up and it starts to create so much pressure that you start getting those nerve symptoms, like maybe it's burning or numbness in the fingertips, to the point where you can't even feel the keyboard underneath your fingers. If it's gotten to that point, it's gone too far and it's time to do something about it. So once again, we talked about that bridge, right? With chiropractic, what we would focus on when adjusting these bones is actually shifting things back up. So almost like we're recreating that bridge, okay? So recreate that bridge, the idea is that it's going to take pressure off of the nerves and the tendons that travel through that carpal tunnel. And if you're taking pressure off, your body says, okay, there's room here, there's space now, we can push blood flow in and out, nerve flow can go back to normal, and it can actually help a lot with the symptoms. But not just help with the symptoms, actually help with the cause of that, which is the collapse of those bones onto the wrist here, okay? Another good thing to do if say you're doing chiropractic treatment or you're working on carpal tunnel, the symptoms and all of that, it's important to have an ergonomic keyboard, ergonomic mouse, especially if you're spending long hours in front of a computer. Gamers too, I see this a lot with gamers. You'll see that the keyboards, they start to they're like these weird keyboards that actually tilt. They create like a U shape, but it's more ergonomic for your wrists. The idea is to not have your wrists stuck in any one position for too long. And then obviously if you're typing away in those positions, you're just irritating those areas over and over and over. If you're doing it once or twice, or you game for maybe an hour a day, it's not a big deal and you probably won't even notice it. But if you're spending 8 hours a day, at a job that requires that, then yeah, it's no wonder you start getting all that inflammation starting to build up. Normally I don't see this till later on. This is one of those conditions that gets worse over time. You don't really notice it at first, but maybe years later it starts to really cause problems. I would try and get ahead of that. If you're already in one of those types of jobs, and even if you're getting early symptoms of carpal tunnel, go get checked out. See if we can maybe work on those bones, work on the muscles of the area too. Take pressure off of those nerves so you're not dealing with this later on. just like any condition in the spine, any condition with the body, it's so much easier to prevent things from getting worse as opposed to trying to fix things once they're already there, once the condition's already been established. Because at that point, that inflammation's already done its job. It's a lot harder to get things to kind of step back. But if we're preventing it, you know you're in a good spot, okay? So I kind of just mentioned a little bit about the musculature too. Another really important thing that you can do on your own is work on the muscles of your forearm. All these muscles connect to the tendons which travel through that carpal tunnel into your fingertips. So if you're working on these muscles, you can self-massage. They have massage guns now. Just work on these muscles, work on the blood flow, and that's going to help relax these areas too, so that there's not so much tension on the tendons where they're connecting into your hand. That'll also help with some of those symptoms, okay? And I probably should have mentioned this earlier, but another way to kind of tell if you have carpal tunnel syndrome, what a couple of tests you can do is if you push your hands together, if you notice, we're compressing right where those nerves are in your wrist. If you push your hands together, hold like that, and just hold for maybe 30 seconds or so, what you'll notice is that you'll start getting that sensation again where your fingertips will start to go numb. That's a good sign that you're possibly dealing with carpal tunnel syndrome. If you flip the hands upside down like that, do the same thing, push your wrists together. Once again, you're compressing everything that's going on in the wrist. And if you get the same symptomatology where you start getting those numbness in your fingertips, you're probably dealing with carpal tunnel there, okay? So yeah, one of my biggest things, and I try and promote the body's innate ability to heal. Your body, if you go to any other doctor, they might tell you, hey, you got carpal tunnel syndrome, let's just snip the part of the wrist that's keeping everything together here, and it's going to open up and create room for all this stuff. And sure, in essence, if you're cutting a piece of a tendon that holds all this together, you're going to get that relief. That pressure's no longer going to be there, but you're cutting a piece of your body that is meant to be there to hold things together. So why not try something conservative? Try chiropractic or try massage therapy. I would try all those things first, and if none of that helps and you've got so much damage in there that you're just like no point of return, maybe there's surgical treatment that can help. But I would say try chiropractic first. See if we can get some relief with adjusting and with muscle work on the forearm, and see if that helps start to relieve some of those issues that you have going on. Once again, if you're younger and maybe you're a gamer or you're just starting a new job or you're at a computer all day long, I would suggest talk to your chiropractor. That, hey, I started doing this. I have no symptoms, nothing hurts, but I want to get my wrists and forearms checked out. Just want to make sure I got good mobility so that you can do things you love and enjoy doing for as long as you want to do them. All right, so that's a bit of advice today on carpal tunnel syndrome. If you have any questions, you can drop them in the comments below, or you can shoot us a call. I'd be happy to talk this stuff over the phone. I'm sure I didn't cover everything that carpal tunnel is about, but yeah, I just enjoy talking about this kind of stuff. So let us know, and we'll see you in the clinic.